hope everybody's doing well. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about sciatica pain areas. So what does that mean? A lot of times when I get asked about sciatica or what is sciatica, I have sciatica, do I have sciatica? I get a lot of descriptions of pain. So we're going to go over tonight what sciatica pain areas are. Where are they? Do you have sciatica? And how kind of a couple things you can do at home to kind of minimize sciatica. So sciatica is a garbage can term. I know nobody likes to hear that, but that's basically what it is, meaning pain down the leg. So when you're talking about sciatica, it generally is not back pain. So if you have pain that's just centralized right here, doesn't go anywhere, you just have some pain here, maybe some pain here, that's really not a description of sciatica. However, in the medical profession, I get scripts all the time that say sciatica and it's just pain here. Generally though, when we're talking and diagnosing, or I don't really ever diagnose with sciatica because I need to figure out where it's coming from. But when somebody walks in with a script that says sciatica, I'm thinking there's pain going down the leg. So usually pain that sits just in the lower back, maybe here, like right on the tailbone, maybe on your SI joint, a little bit further out on the tailbone, or just kind of maybe it goes here. A lot of times we see back pain that goes just, oh, it hurts all the way across or in the middle. That's generally not what we refer to and think of when we talk to about sciatica. So doesn't mean that you don't have pain there, and then it's also going down the leg, but it's usually not concentrated just in the low back. When you're talking about sciatica and you're referring to sciatica, you're talking about it could hurt here, but then it's also going down into your glutes. It may go down into your hamstring. It can go into your quad. It can go down into your knee. It can go down into your leg, and it can go all the way down into your foot. So that's why I say sciatica is a garbage can term, because there is no specific pattern that sciatica follows. We have to figure out, okay, is it muscle involvement? Is it nerve involvement? Do you have herniated disc? That's really what the diagnosis comes down to. So when you say sciatica, you can have pain basically from here all the way down, and that can get you a diagnosis of sciatica. But it doesn't mean that that's what you necessarily treat, because how do you treat sciatica if you don't know what's causing it? You really need to get to the bottom of what is causing that pain. But sciatica pain, or pain that people will often refer to as sciatica, can come in. It can come into the groin. It can go into all the way into here. It can come across the front. So any pain that has, kind of that back pain all the way down the leg can be sciatica. Now it also can be pain that's just in the leg. It can be numbness and tingling that's just in the leg. It doesn't have to be pain. Again, which is why I refer to it as the garbage can term, because it encapsulates so many different things. So many different things can be sciatica. It could be pain, it could be numbness, it could be tingling. It just involves basically the low back of the leg. So you may have some numbness or tingling in the foot. That could be sciatica. You may have no signs or symptoms anywhere else, but you have some numbness and tingling around your foot. That can be a sciatica issue. You may have that numbness and tingling in your calf. That can be a sciatica issue. So it's a very broad definition. It means a lot of different things. Again, when I get a script that says sciatica, generally I know there's pain somewhere going down the leg. May just be in the glute, may just be going down into the knee, whatever. So what can sciatica be? It can be a herniated disc. It can be a herniated disc. So when you get diagnosed with a herniated disc, you have to stop and think, or have it diagnosed, I should say, is that where my pain is coming from? Usually when the disc is causing the pain, we usually don't like to refer to it as sciatica. That's a herniated disc. But unfortunately, so many people are diagnosed with a herniated disc because that's the only thing that shows up on X-ray, or let me say that, the only thing that shows up on MRI. That is quick for an easy diagnosis to say, oh, you have a herniated disc, and you have pain going down the leg. Look, you have a pinched nerve. And most of the time we find that that's really not what's causing the pain going down the leg. So if you have a herniated disc, that's not sciatica, that's a pinched nerve, that's a herniated disc That's causing the pain. But a lot of times that's not what we find is causing the pain. But it's the easiest to diagnose because it shows up on an MRI. And if you've ever had an MRI on your back and you're over the age of like 21, chances are you're going to have some sort of herniation. If you have kids, you're probably going to have multiple herniations just from being so anteriorly tilted for so long and then carrying your kids. So don't always buy into the sciatica, the herniated disc. This is what makes back pain so difficult, and if you don't have somebody who took the time to diagnose where it's coming from, and you just look at an x-ray or you look at an MRI and you're like, oh yeah, herniated disc, that's easy. Oh, sciatica. Okay, so you have pain going down your leg, so just do a couple of these and a couple of these and you'll be fine. You have to really take the time to understand where that sciatica is coming from. Sciatica is not about where the pain is. So if you come in and you're like, I have pain in my foot, okay, we've got to back it up and we've got to figure out where that's coming from. Most people want that concrete diagnosis. Oh, I have sciatica. So where is it supposed to hurt if you have sciatica? Anywhere in your leg. But that disc can also be causing you pain anywhere in your leg. And you have to really do some special tests to figure out if you have that herniated disc. And if you have a herniated disc and want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. But it also could be muscle-related issues. So you could have some issues like a piriformis syndrome. Piriformis syndrome can cause sciatica symptoms, meaning if your piriformis, which is the muscle in your butt, gets really tight, it can cause pain, numbness, tingling going down your leg, which sometimes and quite often gets diagnosed as sciatica, but it's not, it's a piriformis syndrome. So you have a tight muscle in your glute. Now you could also have that tight piriformis and have some sort of nerve irritation, some sort of sciatica, and the way that you want to work with that, and the stretch that I'm going to show you is a stretch that you should be doing anyway, regardless of whether you have sciatica, whether you have pain. It's also kind of a quick and dirty way to test if you have issues. You want to sit in a chair. It's one of my favorites, so if you watch my videos, you know you've seen this before. You want to sit in a chair and you want to cross your leg over. You want to cross your ankle over your knee. This should not hurt. This should not be painful. You should be able to do this. If you're here and you're like, oh, I gotta pull the pant leg to get up, that's a problem. If you're up here, that's a problem. I don't know what the problem is. It could be hip issues, it could be back issues, it could be something from your SI joint, it could be a number of different things. But doing this type of stretch that will involve your hip will not only allow you to see maybe there's a problem going on that you don't even know yet. If you're up like this, there's going to be a problem. It may not come tomorrow, it may not come a month from now. It's gonna probably come in a year or two, and then you're like, oh, I've always been so tight. Now's the time to do something about that. This is a stretch that everybody should be doing every day, all the time. I do it, it's probably the biggest stretch that I do in my office, at home. Okay, you wanna make sure that you are stretching your hips out. So this figure 4, you can do it laying down on the floor where you pull your knee up to your chest with your legs in a figure 4. You can stand up and put this leg on a table. But regardless, this is what you want to do. This is the stretch. Now, if you sit up nice and straight and you have your foot like this, you may feel a stretch. You can feel a stretch on the side of your leg. You can feel a stretch in the back of your leg. You can feel a stretch in your butt. Either way, you want to feel a stretch. Now, if you're sitting up nice and straight, you're letting gravity do the work, you don't feel a stretch. What you want to do is then you want to lean forward. Now, you don't want to collapse, all right? That's not going to do you any good, and it's actually going to cause a disc herniation. You want to just sit up nice and straight and then lean forward, just like that. Nice and easy, all right? So you're able to feel a nice, gentle stretch. If this causes pain, if this causes numbness and tingling, you want to back off, all right? And then just kind of let gravity go to work to pull your knee down. Another way you want to look at this is you want to compare the sides. So you want to put this ankle over the knee. So if this one's up like this and this one's down like this, you have an issue. You may or may not have pain yet from that issue, but you have an issue and it's coming. And it could come very quickly or it may take a year or two to get there. But I'm telling you, if these are not equal, then you have some issues that you want to really get investigated, because that means something's on the horizon. Chances are you already wake up with either a stiff hip or stiff low back, and you're like, I'm just getting old, and I'm blaming it on aches and pains, which part of that may be true, but if you've got a range of motion that looks like this, there's something significantly going wrong that you want to address, okay? So same thing on this side, you want to sit up nice and straight, and you want to lean forward. What you don't want to do is you don't want to push your knee down as hard as you can. You should never stretch to the point of pain. You should never feel pain with a stretch. You should never be partner stretched to the point of pain. I see people getting their hamstrings torn all the time. It is not okay. That's not something you want to do. But allowing this type of stretch to happen will allow a lot of those hip muscles to start to open up, all right? Which is part of one of the causes of sciatica. Now, this particular stretch addresses only a few of those muscles, but again, it's a good identifier to, first of all, see if there's something going on, but you always want to keep those hip joints nice and open. You always want to keep the muscles really in the glutes, in through these adductors, in through the front of the thigh, loosened up, so that way it's easier, to be able to not impinge those nerves. When your muscles get tight, they can start to play some of those nerves like a violin, which is when you start to get numbness and tingling into your knees, your feet, your calves, different areas like that. So just be aware that sciatica pain areas are very, very broad. It's pain going down the leg. The most important thing is to figure out why you have it. You should never leave a physical therapist's office. You would never leave this office with a diagnosis of sciatica. Okay? That's not okay. You've got to figure out where the pain is coming from. Why do you have pain going down your leg? I don't have to diagnose that. You can tell me. Sciatica is something you tell me. All right, you have pain going down your leg. You have sciatica. It's really important to figure out where it is. Okay? Where it is coming from. Sciatica only means it is pain in your leg. It is numbness in your foot. It is pain going down the leg. I can't stress that enough, because I get so many questions on, well, if it hurts here, do I have sciatica? Or if it hurts on the back of my leg, do I have sciatica? If it hurts anywhere from going down your leg, you have sciatica. But what you don't know is, where is that coming from? Is that coming from a disc? Is that coming from a muscle? That's where you really need to figure out and really be concerned, because it can lead to muscle weakness. You can have foot drop, where you're dragging your foot. It's not something that you want to ignore. It's not something you want to try and treat at home. It's not something that isn't going to get worse if you try to ignore it. If you do think you have sciatica, or you have any type of back pain, and you want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.